You're listening to Health Innovators, a podcast and video show about the leaders, influencers, and early adopters who are shaping the future of healthcare. I'm your host, Dr. Roxy Mooney. Welcome back to the show, Health Innovators. On today's episode, I am sitting down with Joe Brown, who is the founder and CEO of Dear Doc. Welcome to the show, Joe.
Thanks for having me. Very excited to be here.
It's good to have you here. And I am excited to be able to hear more about your story and share some insights about your commercialization journey with our audience. So before we get started here, just tell our audience a little bit about what you've been innovating and a little bit about your background.
Yeah. So I'm the CEO of Dear Doc. And what Dear Doc is we're a practice growth platform where we help doctors get new patients, retain their patient base, and increase efficiencies within their practice. And we started the company in about February of 2019 with this idea that we could probably help doctors communicate better with patients in more of a way that's easier for them to get a hold of them. And we tested the idea. My grandfather is a dermatologist. He's been a dermatologist for over 50 years. And he was having a challenge getting more patients into his practice. He's been in business. He's a great doctor. I've been to him many times for my personal self. I know he's a great doctor, but he's having a hard time getting people in. And so the idea was, could we figure out a way that I was looking at his website, I was looking at his online presence, and everything seemed pretty good, but he was getting a lot of people to his website, but he wasn't converting people when they actually got there. And so I thought, there's tools for this. They definitely exist. I know, the companies I'd worked at previously had different tools, whether it was like some type of chat widget to engage patients that way or engage consumers when they came to the website. And so I was like, you should probably put some chat on your website. And I was looking at the market to try to find some chat solution. I knew that his team wouldn't have time to answer chats as they come on board, so it had to be automated. When you found out that back in the late 2018, there was no company that existed that did HIPAA compliant artificial intelligence chat for the healthcare setting. Mm-hmm. And I thought this could be a really big opportunity, not only to help my grandfather, but potentially help the entire market. We tested on his website. It worked out. I mean, he would go from getting 10 leads on his website to no more spend in marketing to get like 25 or 30 leads. And so I figured that if this could change his website that much dramatically, this could be really helpful for tons of other practices. We did it with one of his friends. They were successful. And long story short, the company started in February 2019. It was just me on the team. We had no customers. And fast forward to today, we have about 160 people on the team. And we actually just passed our 3,000 customer.
Wow. Congratulations. That's huge.
Yes, it's been really exciting. A lot of fun.
So I want to go back. So I understand the root of the story, right? And in the targeting strategy. But I have to say, as I started to get to know you and Dear Doc more, a little bit more, I started thinking, gosh, this is one of the most difficult target audiences there are out there with physicians, right? Private practice physicians just really struggle today to be able to, like you said, be able to get these patients coming in and a pipeline of patients coming in. And so it's interesting to know why you chose that. I also noticed when you're telling your story, you kind of touched on marketing, but then you talk about these software tools. So what made you not position yourself as like a traditional marketing agency versus these tech tools that really maybe differentiate you?
I mean, yeah, it's a good question. I don't come from the marketing world. I come from the software world. I've been part of multiple software companies here in New York City, and historically been, I was one of the startups I worked at. Software company got acquired for $100 million, and so that was a great learning experience to watch the company go from literally nothing to one of the biggest tech acquisitions in New York history at the time when it happened. And worked at other startups. And I had this really cool opportunity working in different software companies. So I don't come from the marketing world, I come from the software world. And so that's where, for me, it really clicked that, you could leverage software to not only help doctors, because a lot of people, I think software can help, whether it's a EMR, like some type of patient management software. But there's other ways software can help grow practices outside of that. And that's where we really want to tap into.
Sure. Yeah. Sounds great. So as we think about the targeting strategy and the, being able to get in front of doctors, right? They're so
hard.
competitive, right?
So hard, yeah.
You've got pharma with very, very deep pockets. You've got med device also with deep pockets that are all vying for their, 10, 15 minutes of getting in front of the physician. So what are you doing differently to be able to market yourself and to be able to get your offer in front of so many physicians that you've been able to convert, nearly 3,000 or 3,000 within just a couple of years?
Yeah, it's a great question. It's hard. I mean, we've tried everything. Like we tried Facebook marketing. It could just be because I'm not great at it. That didn't really work. And we've tried mailers, and we tried going to office. Like there's so many things we've tried, but my background. So I grew up when I graduated college. I got a job in sales and software. So I've had the background. I started in sales, moved up to sales manager, and then eventually sales trainer. And I started training classes of 30, 40 salespeople in a class like almost every other month. So I was like training a lot of salespeople pretty quickly. And so my background comes from, the way I was taught was actually just through cold calling. And so calling people, getting their attention as quickly as you can, and giving them something of interest for them to actually, spend a few minutes of their time learning about your product.
Sure.
And so that's really, for us, we grew our business a lot on cold calling. We do a little bit of partnerships here and there, but really the bulk of it has just been our background of just calling people and asking, giving them a short version of what we do and trying to get them interested to spend a little bit more time with us. And that's kind of been the premise.
Gatekeeper at a medical office is no easy feat. So congratulations to you and your team.
Thanks. We have a very talented team, just a very great team. And we all have this mission. They're all behind drive of how can we reinvent how healthcare has been done, or how can we reinvent how new patients meet their doctors. We constantly are at this mission of trying to reinvent. And I think that's what gets our team. They have a hard time having to make hundreds of dials a day to pull this off. But they're doing really well.
Yeah. So tell us a little bit about your team. You mentioned that you have 160 employees. That is a really, really big team, especially I think for such a young company. So how are you structured? And then let's talk about your leadership, being able to lead, such a large team.
Yeah. Well, I think in any really good business, you need because we have a great leadership team. But early on, we brought on a lot of these really great leadership, and it's crazy because we didn't have any money. So we didn't raise capital. So we had to figure out a way to get a product built that was our products improved significantly from the early days, but
sure.
We had this product that just pretty much did the bare bones of what it could do to help. And then, but we had to also grow the business and hire people. And so we hired really great leaders early on. And so I think in any great business, you need someone who's really great at getting sales in. So you need a really good person who's really good at bringing sales in. We have an incredible vice president of sales who does an amazing job of taking care of that part of the business. You need someone who can actually fulfill on what sales is doing. So sales can sell a million people, but if we're not fulfilling,
sometimes we forget that, don't we?
Yes. So you need someone who's amazing at being able to not just fulfill, but provide just an A+ amazing customer experience, which we strive for every day. We hope that people think our experience is amazing, but we're constantly getting better. And then you need someone, I think, another really important role is someone who's in charge of making sure the books and everything is in line. So making sure that we're spending money in the right places, we're not overspending in the wrong places. Payroll is getting taken care of, administrative things are getting done in the background, benefits for our employees, all that stuff is happening. So we have really great people in those roles. And so we had those people come on pretty early on, we're less than a year old. And so they've been able to then underneath them, since they're so good, be able to build and scale teams underneath them that help us serve more and more people. And so it's not easy. I mean, we interview tons of people just to get, in our sales team, it's very competitive. We'll have 1,000 people apply for our roles for a sales class, and we'll hire 5 or 6.
Yeah.
So it's a really low acceptance rate, but we have a main recruiter who just focuses on recruiting all the time. So she does a really good job recruiting people. So we've been lucky enough to have a product that adds value. Something we can talk about a little bit later is like the whole COVID, what happened during COVID, because that was also a pivotal time for our business.
Yeah.
But
So,
that's really it.
you kind of touched on something that I think every single business owner nearly goes through, is this kind of chicken or the egg kind of thing, right? So you need to be able to have money to build a product, to sell it, but you need to be able to have sales. So you have cash flow to be able to have money to build a product, and you need to be able to have great team member, high quality team members, in order to start building out the culture and building out the business, right?
Yeah.
But you also need to be able to have money to be able to hire those. So just talk about some of the challenges that you went through and how you were able to overcome them.
Yeah, I mean, we got really lucky. I mean, I was, like I said, my background's in sales. So I knew I had worked with and been in New York, the sales world. So I was the head of sales at the last startup I was at. And we built a huge team there. And I've been connected with really great salespeople and sales leaders throughout my time for the past 7 years or so here in New York. And so I was able to, because I had a good relationship with some of these guys, bring on some salespeople early on. I was like, listen, the product's not really there yet, but it will be. Just have faith, have trust. So you bring those salespeople on pretty much on commission base only. I had the reputation of being able to build and scale sales teams where even if they were commission only, they were still going to make really great money. Because the sales process wouldn't be in place and all that stuff. And then like our CFO, who came on like 2 months after we started the company, 3 months after, like he was one of my best friends from high school who happened to do a lot of amazing things after he graduated college and doing these things. I remember calling him and saying, hey man, like I'm starting this company and we're looking for a CFO who could, really run the day-to-day and really own this kind of finance of this company. It's going to be really exciting, all this stuff. Do you know anybody? And I was in my mind, I'm thinking, please say you, please say you, please say you. And he goes, he's like, yes, that sounds like really freaking awesome. I don't want to say the real word he said, really freaking awesome. And he goes, maybe that could be me. And I was like, well, yeah, man, if you're interested, let's definitely talk more. And one thing whenever he came on board, he was actually the only person at DearDoc to take, besides our first couple of salespeople who were commission only, but they got paid when they made sales. He came on no pay and like no real guarantee of pay for at least 90 days. And that was a huge risk for him. Now, he's able to get paid at, I think, a great salary and those types of things now that we've grown the business, but he took a big risk. And so I think like it's using your relationships with people that know you and trust you and know they're going to take care of them. And if you can find those people and they believe in you and what you can do and you believe in them, it's a recipe for success, in my opinion.
I really think that that's so important because so many times I think that innovators are just, they're struggling with the financial piece, right? So they're just looking for free talent, but you don't necessarily have those strong relationships with high quality people. And it can really, sabotage your business, getting people that are working for free, because not everybody that's willing to work for free is going to be those high quality or high caliber people. So I definitely agree with you. I think the relationships and the network that you have to be able to tap into is really, really important.
And giving equity, like people thought it was because I gave good equity to the first couple people that came on board, and some people, we give, bonuses and those type of things as equity in the business too. But I set up the business in a way where I never wanted investors, but I wanted it in a way where we could give out equity to different people, especially in the early days. They're helping build the business. And so I think I gave up more equity than people thought that I probably should have in the early days. But for me, it was really important because these people were taking a huge risk. It's something that they had no way that, people think I take a big risk starting the company. I was like, no, the people that joined on early on, those people took a gigantic risk, bigger than I did, because they had, high-paying jobs doing really amazing things. I come join this guy. We're working out of my apartment for the first 7-8 months of the business, my 1-bedroom apartment in New York City.
Right.
It was just crazy. But yeah.
It's funny because I was one of those people early on in my career. I can't tell you how many, stock certificates I have that aren't worth the paper that they were printed on. They never came to fruition. I didn't work for free, but there was, some type of negotiation there. So being able to make that part of your, payout and being able to attract great talent, I think is really important, especially for our listeners.
Yeah. And take care of your people. It's like your most important thing.
So let's talk about COVID. How did COVID impact your business, and how is it currently impacting your business?
Yeah, it's a great question. when COVID hit, so we were really kind of focused, our angle and our value proposition was we're going to get you more new patients. That's a lot of our value proposition. And when COVID hit, like I think it was March 13th, and people stopped going to work, and all of a sudden doctors' offices were just closed, and we were calling dentists, and dentists like, why would I ever need new patients? This is like the last thing I'm thinking about right now. I can't even see my existing patients right now. Why would I ever need this? And so our team is like scrambling. They're like, what? I don't know what to do. What's going to happen? All these things. And so we were just like brainstorming as a team, and we're trying to figure out, like, we're in the business to add value to our clients. If like we give them a way to get more new patients and they can't see them, we're not adding any value, and we in theory shouldn't even exist. Yeah. And so like our question was, how do we add value? Because I think that one of the things Tony Robbins talks about is like, the quality of your life is the quality of the questions you ask yourself. So if you ask yourself the right questions, usually we'll find your brain has to come up with an answer. So we ask, how do we add value? How do we add value? We kept repeating that question over and over and over again. And one of the things we had on our product roadmap to finish by like the end of 2020 or sometime middle of 2021 was this idea of telemedicine. We had started the kind of outline of what it would look like. And someone's like, well, what if we could launch telemedicine? It's like, well, that's like something we had totally put on the back burner because it wasn't something we were all that excited about before COVID. Right. Our customers needed it more than anything. And so we sat down with the team, we got everybody together, and we mapped out like, what could we do to get the minimal viable product that would just somewhat add value to our clients in a short period of time. And our team, we laid it all out. People were working, almost all day Saturday, all day Sunday, late nights. We were just constantly looking at how we can try to build this thing out. By the end of March, I think like March 29th or March 30th, we had officially had some product that was ready to go to then give to our sales team and to our customer experience team to give it to our customers. Say, hey, here's a way to add value through the pandemic. So not only can we send you new patients with some of our other products, you can actually see them through our telemedicine solution. We're one of the first people to start reaching out to these doctors with some telemedicine solutions. We got it done in like 2 weeks. Right. But it shows what happens is like, it's like necessity breeds innovation. And that was like the perfect idea of it. And this is what I love about DearDoc so much is like when challenges come our way, we don't just say, I guess that's it. I mean, 90% of all of our people that were, selling to doctors, or 90% of the people in the market were laying people off. They were downsizing. And if you look at some of the statistics of like 2008, when there was a recession, and the companies that laid people off, the people that stopped spending money on marketing, stopped spending money on sales, 10 years from that point were the losers in the long run. And so we knew that. So we said, we have to invest now. And so while it was super risky, right, we hired way more people. We hired people that we probably could never have hired because they got let go from these great companies. We brought them on board, and all these things. So we hired more people. We pushed more sales. We did everything. In April of 2020, at that moment, was the biggest month in like sales we'd ever done as a company. Yeah. To think. And so we had gone through, March was one of our worst months we ever had as a company because we couldn't sell anything for half the month and do anything for half the month, versus April being one of our best. Now we've obviously beat that since, but it was just a crazy moment for us in our history.
So that is amazing. And, we hear that we hear some of those stories, right? Because you had different industries that were able to pivot and adapt more quickly than others, and be able to take advantage of some of the changing trends that actually work to our advantage. And being any type of digital health certainly has helped. So how was it for you competing against some of the bigger brand name telemedicine solutions that might have already been into the marketplace? Or even if they still had small market share prior to COVID, was that something that you faced?
I mean, it was great when we faced someone that had it, because if someone already had telemedicine, it's like, okay, well, our other products can be great for you if you already have telemedicine. But if you don't have telemedicine, well, you need it because we don't know when this thing's going to end, right? This COVID thing could go on for 2 months, could go on for a few weeks, could go on for a year. We don't know. And so you need this thing now, obviously. And so it didn't matter if someone already had it, amazing. Like we could just offer our other products. And if someone didn't have it, that was just included in the bundle.
Yep. The beauty of having a broad product portfolio.
Yes. You should always have multiple products. That's one of the biggest things I can recommend to somebody who's like, you can make it to like, you can make it to a certain point, let's say $1 million in revenue by just having maybe one product in selling into the healthcare space. But if you want to get more than that, I highly recommend having multiple products so you can help people no matter what stage of business that they're at. And you have different things that can help them grow and make things better for them.
Yeah. So how is COVID impacting your business today? Access to practice staff or to hospital system. Medical offices has, kind of opened up, closed up. We kind of keep going back and forth. How is it impacting your business today?
It's not. It doesn't seem like it's impacting it too much. I don't think it's because COVID with telemedicine was actually somewhat, our business was almost helping, right? Because we had a solution that people needed. Yeah. But for right now, it's kind of evened itself out. It's like people, if they don't really, most people are actually going into the office. Most doctors, I know things are kind of closing up like as of a few days ago or like a week ago, back again. But for the most part, people are still going into the doctor's offices. They're wearing masks. They're doing the normal thing. So there's less of the telemedicine stuff. So everything's kind of somewhat back to normal. So I don't think it's really impacting our business now. We still do tailor our message when talking to customers about COVID, and those things are still existing in our the way we communicate with customers and how this product will help, obviously, with or without COVID. But I wouldn't say it's impacting us too much right now. And I would say even like our products, like we're not developing products for like this telemedicine first world. I think a lot of people thought maybe telemedicine was going to be the future of what we do, and I do think there'll be way more telemedicine than there was before COVID. For example, follow-up appointments and those types of things. You don't have to go drive in a car and get to the office. You can just go over on your screen, which I think is way better. But I still think we're still going to go to the doctor's office when we're not feeling well to get checked up and everything, for the most part.
Definitely a hybrid model is what the future is going to look like, for sure.
Yeah.
Mm-hmm. Hey, it's Dr. Roxy here with a quick break from the conversation. Are you trying to figure out what moves you need to make to survive and thrive in the new COVID economy? I want every health innovator to find their most viable and profitable pivot strategy, which is why I created the COVID Proof Your Business Pivot Kit. The Pivot Kit is a step-by-step framework that helps you find your best pivot strategy. It walks you through 6 categories you need to examine for a 360-degree view of your business. I call them the 6 critical pivot lenses. As you make your way through this comprehensive kit, you'll be armed with the tools, tips, and strategies you need to make sure you can pivot with speed without missing out on critical details and opportunities. Learn more at legacy-dna.com/kit. So what is the biggest challenge that you're looking to solve in today and in the near future?
We're always asking the question of how can we be more valuable to our clients. And so we don't know. I don't know what the exact things are going to be, the problems and things that we'll be facing probably in a year or 2 years from now, because we're going to constantly be evolving. Like I think sometimes people get so stuck on their when we started the company, we had an artificial intelligence chat that would help doctors convert people from their website. But it was never that we were a chat company. It was a company that was here to service the healthcare space in any way we possibly can. So if we see an opening in the market, or something that could potentially help these doctors, we'll try to recreate it and offer it and see if it works or not. And we're just we have tons of failed experiences, tons of failed experiments, a ton of successful experiments. And it's just been, I think, as long as we're doing one of those 3 things, as long as we're getting people more patients in a way, we're getting them to be able to retain their patient base better, or we're helping them increase efficiencies within their practice. If it's one of those 3 things that we're doing with our products, then it's a win. It's what are those things going to be? Our products can definitely evolve, and we're not married to a certain idea. It's until it doesn't seems to be ineffective, or there's a way more effective way to do something, we'll do the more effective way.
Sure. Yeah. One of the things that I talk a lot about is co-creation and bringing your customers into that discovery process of really being understanding the challenges that they're facing today, or the things that they're worried about for tomorrow, being able to anticipate or even co-create that next version of solutions with the customers. Sometimes we think that we need to have all the answers and we need to have it all, like, even an MVP to like present to them and get their feedback. But even being being able to go super early with ideating with them can prove to be extremely valuable. I often use the example of Starbucks, where 70% of their new ideas don't come from anyone with inside the company. They come from their target customers. They're always asking their consumers, what do you need next? What do you need now? I mean, it doesn't mean that they're completely 100% owning the product roadmap, but they're certainly driving a lot of that. And then that you're inventing something or innovating something that your customers want because they helped, shape those ideas to begin with.
Yeah. Yeah. I think asking those questions are important, and surveying your customers is extremely important. But something I think that some, especially technology companies, like we're innovating, we're changing how things are done previously. I think about, you ask them the problems they're facing, right? And they may think they know the solution that they want for that problem, but in reality, a perfect example is Henry Ford, when he talks about, maybe you've heard this quote before, he's like, if I would have asked people what they wanted back in the early 1900s, they would have told me I wanted a faster horse, not like not a car, right?
Yep,
and so they want to get places faster. So ask them feedback, get that feedback. I want to get somewhere faster. How can you make my horse go faster? Well, we could probably make this thing easier if we created a car and got there even quicker. And so that's where I think your customers will definitely, and you may have some innovative customers that are thinking outside the box. They're just going to say, hey, I really want to be able to do this better or this thing easier. And then it's up to you a lot of times to think about, okay, but I know this logically makes sense, but what if we could do this? And what if this was possible? And then start asking those questions. And usually some of our best products and stuff like that come out that way.
Yeah, definitely. Especially when you're talking about something that's really revolutionary or disruptive. Most of the time, those are not going to come directly from the customer's mouth, but through that dialogue is usually where that creativity and ideas are sparked, right? Just like you described. Yeah,
exactly.
So, some of the tools that you offer are things that, I know that you're targeting private practices, but they really could be used even for the businesses, for the people that are in our audience today. So thinking about the health innovators and them too, also being able to convert their customers. So just talk a little bit about how AI chat on a website or even, automated tools to either collect or display Google reviews for social proof. Just talk a little bit about that and the overall value proposition and how that might impact a commercialization strategy.
Yeah. So, I mean, it's everything. I mean, like the world is online. And so people are going to be finding you online. I mean, I don't think no one has to be convinced of that anymore, right? We all know that, especially people watching the show know that.
I don't know. In healthcare, I think there's a bunch of laggards that are still really not sure.
Well, if you need the nudge, people are online, so make sure you take care of your online presence. Even probably better than you would take care of the front looking of your store, right? It's more important to take care of your online presence than you do like cleaning your windows. I know you want clean windows, but anyway.
Yep.
So take care of your online presence, and so like. Something like an AI chat is fantastic and we have it on our website, obviously. But what it does is it allows people to get their questions answered immediately. And so what we found when figuring out the right product market fit was that 75% of people who go to a website will go once and never come back again. And so if you only have really one shot to convert somebody into a paid appointments or a paid customer or client, whatever the business you have, you better do everything you can to give them the things they need to be successful at that one visit on their website. Like they're not going to assume they're never going to come back again. And so the AI chat allows them to ask questions for our doctors, for example, what insurance do you guys accept? Do you guys do this type of service? I have a child that's 2. Do you guys see children? Whatever questions they may have, answer the question, but then follow up right after with, would you like to request an appointment? Yes or no? Yes. Okay, awesome. Let's go through that process and request an appointment. And so we were able to get leads that they would never have gotten other than having a way for us to communicate. It's kind of like, imagine if you went into a retail store. I mean, I worked in retail. I think this is why I'm so obsessed with the chat idea with the website, is because I used to work in retail as a sales rep. This is where I learned sales my first time, working at a PacSun, if anyone that's familiar with PacSun. And the difference of me being there versus me not being there was significant. The more stuff people were able to find and buy because I was there to help them and guide them was way more than if the store was completely empty and people were just aimlessly walking around. They may never knew that if you bought 3 shirts, you get a 4th one free. They may have never known these other things that are going on within the store that we highly recommend you do. And so for me, it was a no-brainer that when someone's on the website, that's like your your retail store, your practice online. So you need somebody that can guide them and talk to them and help them throughout their process to really increase conversions.
Yeah, absolutely. Again, I know that we're talking about the use case for Dear Doc that's like specifically for medical practices, but I want to make sure that we're stressing for our audience today is that this really is for any business.
any business. Like I said, it works for clothing stores. It can work for any business. If you're a coach, any type of business you have, people are going to have questions. They need to be able to answer them. And I highly recommend using some type of AI chat to be able to convert them, engage them. If that's Dear Doc, amazing. And we're starting to look at what our business looks like outside of the healthcare space. So just getting into other types of businesses. But regardless, I highly recommend. It's imperative and super valuable.
So some of the questions that I know come to mind is if I'm a direct to consumer business, or even if I'm a B2B business, but I may be, communicating with people in the practice staff, or hospital system that might end up asking me about a specific patient through the chat. So how do you overcome some of the objections around HIPAA or PHI?
Well, HIPAA is, when you're collecting like information, like we don't answer any medical questions. So like, we're not like, my eye hurts. It's like, oh, let me recommend what you should do if your eye hurts, right? So we're not doing any of those questions. It's very simple questions that, anyone can answer. What makes, why you guys better than the practice on the street? What makes it unique? Services, insurances, those questions that are pretty normal. So as long as we're not giving any like healthcare related advice, number one. Number two is like when you're collecting this data, like we collect names and phone numbers and email addresses of patients, everything has to be encrypted in the back end. So by encrypted, meaning that it's, the database that it's stored in is, it can't be, it's not saved as a name, it's being encrypted and encoded in. And making sure that information, everything is safe. And we have to get our whole team has to go through HIPAA compliance training every single year. Once a year, they have to go through all the training. When a new hire starts, they have to go through all the HIPAA training. So there's certain things that make your company HIPAA compliant that you have to go through. There's companies that you can hire to help you with that process if you're looking to get HIPAA compliant. But yeah, I mean, it's really just making sure you're taking care of the PHI, which is like that information of the patient, and making sure that's encrypted all the way through.
Yeah, good insights. Just because, in healthcare, there's inevitably someone that wants to throw out, oh, I don't know if we could do that because of PHI or HIPAA, right? It's just kind of like these buzzwords that they just like to throw out.
Well, it's scary. It's scary for the doctors. They've heard horror stories of people, getting, it can be scary for them sometimes, for sure.
Their businesses getting sued. Yeah, absolutely. So then let's just kind of start talking also about, reviews and testimonials and social proof. I think that just overall, it's kind of the same thing that we're talking about. Overall, this is valuable to every business, certainly valuable to the health innovators that are on here. And I think that there's still either a knowledge gap or an implementation gap around integrating social proof into the business and how critical that is for future sales.
Yeah. I mean, it's social proof for many reasons is obviously a big influence. Like we always, as human beings, we like if other people had a good experience, we assume we're also going to have a good experience too. And so we always look for social proof. What's important for like local businesses, especially, is that like 91% of people that are looking for a local business will trust online reviews as much as a recommendation from a family or friend member, a family or friend. So if you aren't like, if you may be the best doctor in the world, but if you have 8 reviews and a 3-star rating, like there's gonna be a lot of people that are gonna pass right by you. And that's what's it's unfair. It's unfair because you're a great doctor. You spent so much time and energy making your practice a great one. But if your online presence doesn't show it, it doesn't really mean anything. And so you need to make sure you're generating a lot of reviews. And if you're a great doctor, you have tons of happy people who are more than happy to do it. And what Dear Doc does is helps the patient do it fast. You don't want to make it complicated for your patients to write something great about you. And so we allow them to send a message saying, give us some honest feedback if you can. And if you can, write us a review. And it's just like click one button on a text message, they can write a review very quickly and easily. And so, I think one other thing is as we go online and we talk about how the importance of reviews online, I was sitting at dinner last night with my fiance and her mom, and my fiance bought something on Amazon, like a piece of clothing on Amazon. And her mom's like, you would buy that? Why would you buy? You don't even know if it's going to be good. How do you know? And she's like, I looked at the reviews.
Try it on.
They were all amazing.
Mm-hmm.
And it's like, bam, it's like that's our world. It's like if other people say it's good, I haven't tried it on, I can't see it, I can't touch it. What other people said it's good, I'm going to buy it. And so I think that's the world we live in. We have to understand the value of those reviews. Is that people are going to trust those things as much as a recommendation if it was a friend or family.
Yeah. And I think, and that's so true. I mean, I know that you rarely trust what a brand says. You trust what your peers say, and you believe that those people that are posting those reviews are comprised of your peers. I look at reviews for nearly everything that I purchase.
Yeah.
Yeah. It's interesting because like these things that you're talking about, they're not necessarily new and innovative for like other industries. They've been applied there for like 10 years plus. It's just that we're still, as in healthcare, the industry is just kind of still falling behind. And in healthcare, there's definitely a lot more weight, which rightfully so, on being able to generate that clinical evidence to demonstrate the safety and efficacy of whatever it is that they're bringing to market. And I think because there's so much emphasis on the clinical evidence, that we often forget the role that social proof and those online reviews really play into that sales process.
Yeah. Yeah. I mean, exactly. You may come from the best school, and you may have like the best background and all these things. You've been a doctor for 20, 30 years, but it only can pull so much weight. And you need something that's going to completely differentiate you from the practice down the street. And so what I highly suggest is like, if you're a dentist, you type in dentist in your area, and there's a list of, 5 or 6 doctors, I challenge you to try to make yourself at least have the highest number of reviews. That it's not only just like, are you 5 stars? If you're 5 stars in one review, they're going to think that someone in your office had written that one review. Like at least like 100 or 200, those numbers really make a big difference. And if you're 4.4 and have 400 reviews, people are going to be much more likely to go to you.
Yeah, absolutely. And I think that if we ever had any type of analysis and we queried the where we are with Google business pages for healthcare brands compared to other industries, we'd find that there's a huge opportunity for us to be able to leverage these tools that are out there for us to be able to grow our businesses.
Yeah.
Yeah. And then be able to automate that process, I think, is really important too. I mean, old school would be is you would have somebody that would create a PowerPoint deck to, pitch their offer, and they would have like a map of the US with a couple of logos of the customers that they were doing business with, but just really outdated compared to, or, testimonials that, like, hey, customer, give me a testimonial, and then you kind of tweak it and put it on your website versus the dynamic nature and the ongoing potential of, like you said, hundreds of reviews versus these 2 or 3 static reviews that I put on there 3 years ago.
Yeah, it's recentness, and like it helps with SEO too. Like, and we haven't talked about this too much, but search engine optimization. So like, where do you come up on the search? I mean, Google looks at reviews is a big thing. Another great example is like the stuff that people put into reviews also is like really helpful. So I mean, there's tons of stuff I go on here, but like I was looking for a gym recently that had a steam room and near my apartment in New York City. And I just typed in steam room and gym, and this company didn't have it listed really anywhere online except in their review. Someone wrote a review at that point, hey, I really like their steam room. And so I went there. I actually checked out yesterday, and there was a beautiful, huge steam room that the review said it was amazing, but they didn't really have it listed anywhere online. And so if that one person didn't write the review, it would never have popped up on Google, but Google's indexing what's on reviews. So you're getting people to say like, great doctor, best doctor in New York, or, whatever these things are, the much more likely you are to come up in these searches. So there's tons of reasons why. And also when someone types in the word best dentist near me, something that's good to know is that it won't show any practice that's less than 4 stars. So if you're at a 3.9 and someone types in best dentist near me, you won't even come up in that search. So you got to make sure you're at least over 4.0 to even come up for that.
Yeah. And, I mean, that's really great to share with our audience, because I think it just drives some of the importance. I mean, I think that what you're talking about for SEO is important, whether you're talking about a national business or even a local business.
Yeah.
And it's SEO is, again, as prevalent as it's been for so long, it's still kind of like this misnomer of like, I really don't know what that is. So I don't know what I should pay for it. I don't know what I'm really going to get for it. It doesn't happen overnight.
Yeah.
Yeah. So I think that again is just another tactic that many healthcare brands that are listening today are probably missing out on their marketing program that is hurting their commercial success.
Yeah, definitely.
Yeah.
Definitely. So important. It's so important.
Yeah. So I want to switch gears a little bit, Joe, and talk kind of going back to, being an entrepreneur, being a founder. What are some of the practices or habits that you've put in place to help you be clear-minded, be focused, be able to be a healthy leader, especially, as we're going through COVID over the last, year and a half?
Yeah, that's a great question. I mean, I got into, it could be coincidence. I don't know if it's coincidence, but I started a lot of things. I kind of got in the habit. It's starting like really good habits, I think helps out a lot. So like, I wake up every morning and the first thing I do is, I'll give my morning routine because I think this is really helpful and hopefully this helps someone trying to grow their business, keep them level headed. So I wake up every day around like 5-10 a.m. or something like that, and sit in bed for about 10 minutes. And I think about, like, before I go to bed, I think about some of the challenges I'm facing in our business. I just think about like, how do I overcome that? How do I overcome that? Whatever. I'll wake up in the morning and some of my best ideas that we've had for Dear Doc, at least, our team comes with much better ideas than I do, but the ones I contribute to, if I contribute ideas, they usually come in that first 10 minutes. I'm sitting in bed thinking about like, what did I dream about? What was I thinking about last night in my sleep? And I'll come up, have an idea, bam, I'll go to my phone, I'll write it down real quickly. And then like a few hours later, I'm starting my work day. I'm like, oh, that idea is amazing. I should tell so-and-so about this. So first 10 minutes as I think about it, I think about what I had dreamt about it the night before. I meditate for 10 minutes every day. I've meditated for 10 minutes every day for like almost like, I think, because I use Headspace and it keeps track of each day you meditate. It's been like over 1,300, like 1,300 days in a row so far. It's like,
whoa.
Yeah.
So as you think about that, have you've seen the difference and how, of course, I'm sure it's impacted you on a personal level, but how has that impacted you on a professional level?
It's night, and I'm upset. I wouldn't go without it anymore. Like I know what my brain was like before. I would take 10 minutes, 10 minutes a day, 10 minutes out to meditate every morning versus what it like after. And so I already know that I've already seen both worlds. I'm not going back to the old one anymore because it's such a better one. And I'm able to think clearly. I'm able to stay focused. It keeps you aligned because a lot of meditations, like getting back to the breath or getting back to the thing that's like, that you're thinking about in the moment or talking to. So if you're having a conversation with somebody or you have a hard thing you're trying to overcome, it teaches you to be able to stay focused on that thing without having your mind going like 100 different places at once. And so meditation is a big one. I then journal directly after. In my journal, I write 3 things I'm grateful for every morning. This is also, I started meditation at the same time. So 1,300 days about in a row, journaling 3 things I'm grateful for every morning, and then journaling about all the amazing things that happened the day prior. So everything I did that was amazing happened the day before. And so like, you may say like some days could be like not great, but you have to do what you can to find the things that were amazing that day and write those in the journal. You can always find something.
Yeah.
Mm-hmm. So that's it. And then I work out 6 days a week, lift weights or run. I run once a week. So exercise also really, really important.
It's funny. I've interviewed hundreds of innovators over the last few years on this show. And, besides just the work that we do, I'm always talking to entrepreneurs and innovators. And I don't have any true data to substantiate what I'm getting ready to say right now. But the ones that are taking care of their physical well-being and have some type of mindset training habits in practice, like you just described, usually are the ones that are much more successful than the ones that are not carving out that time and just completely immersed and invested in their businesses. Which we hear a lot about, but it's just really good to emphasize that. Sometimes we think it's an oxymoron that I'm going to take time away to go do these things, right? I'm going to take time away to go to the gym when I could be here solving a problem, but it actually becomes much more effective. We become much more efficient, more productive when we take that time for ourselves.
Yeah, Jim Rohn, great guy, and great personal development speaker. He trained Tony Robbins. Jim Rohn, he talks about you should work harder on yourself than you do on your job. And if you work hard on yourself, you'll improve, become better, and you'll be better at your job. And so I'm always took that to heart. So I'm always, and then, if I'm not, and I'm also reading and learning every day. Like I'm constantly a student trying to get better at being a better leader. I mean, so I was talking to someone earlier, I think last night, it was like the difference between like an entrepreneur, in my opinion, and like a CEO, because once your business gets to over 100 people, what made you great as an entrepreneur isn't always what's going to make you great as a CEO long term. There's different skill sets and things you have to do when you start getting to like a larger group of people and you're leading them to hopefully to a place of success. And so I'm in that process of like really developing my skills to become better at becoming the best CEO I possibly can. I love the entrepreneur part of like starting this thing from the ground up, and I still have the entrepreneurial tendencies to create new products and new ideas. But like that can also cause chaos when I'm constantly creating new stuff, and then the team's like trying to figure out how it all works. So it's like, for me, I have to take a step back a little bit and become more of that CEO than the entrepreneur. And that is, I'm also learning and trying to get better and better at that too.
Yeah, absolutely. I agree that there is a different skill set and kind of attitude, if you will, that you need when you're that like scrappy startup versus when you're, looking to more scale the business and take it to a different level, more structure, more processes. So what is, as we wrap up here, what is something that you want to make sure that the audience takes away from our conversation today?
Well, hopefully, adversity, like the COVID situation, can only, depending on how you look at it, you can look at it like, is this the end or is this just the beginning? And so I think really looking at adversity the right way, and asking the right questions, not saying like, shoot, like, why did this have to happen, or why we have to go through this, versus how can we, the question we asked, right? How can we add more value to our clients in this time? And then don't just ask it once, repeat it over and over and over again. And yeah, I think just like, have fun. And if you're someone that's interested in, I don't know if you're listening, if you're interested in wanting to learn more about me, I'm maybe you'll ask that question in a second, but if you want to learn more about me, you can, I have a podcast, which is Creator of Circumstance. It's on the Apple Podcast, Spotify, all those different places. And if you're interested in working at DearDoc, or you have somebody that's interested in potentially working at DearDoc, go to careers.getdeardoc.com, and you can apply for any open roles there. Maybe it's a friend, family, younger brother, younger sister, whoever, son, daughter. We're constantly hiring more people to try to help and serve more in the healthcare space.
Oh, wonderful. Love it. So thank you so much for joining us in the conversation today.
Yes. Thank you for having me.
Thank you so much for listening. I know you're busy working to bring your life-changing innovation to market, and I value your time and attention. To get the latest episodes on your mobile device automatically, subscribe to the show on your favorite podcast app like Apple Podcasts, Spotify, and Stitcher. Thank you for listening, and I appreciate everyone who shared the show with friends and colleagues. See you on the next episode of Health Innovators.